Hi, this is Kevin Ashworth with Fighting Fear with Kevin Ashworth, where I do a video blog talking about anxiety, cognitive behavioral therapy, parenting anxious kids, OCD, panic disorder, generalized anxiety disorder, basically just being human and trying to navigate the world and not making so many decisions based on how we feel. Today I'm going to talk about phobias. Somebody asked me to talk specifically about dental phobia, and so we will address that as well. You can't talk about anything in particular without kind of taking a step back and looking at the bigger picture, because anxiety really functions the same way. The content shifts, and so one person's fear might be the dentist, the other person's fear might be dogs, the other person's fear might be bridges, and then of course a little bit more abstract or complex seemingly is, fear of rejection, failure, being perfect, not being loved, and then being judged or critiqued. But phobias by definition are really specific or circumscribed fears that people have intense reactions to, or more intense than the typical person. And we then engage in ways to avoid the experience, or we endure that experience with pretty significant distress if we have to manage it. And for many people, phobias are one of they have the highest prevalence rates for many of the anxiety disorders, but people don't really get treated for them because they can manage their life by avoiding pretty effectively. And so, for example, if you have a fear of spiders, you just might not be an avid hiker or camper. If you have a fear of bridges, you try not to live in Portland, Oregon, I'll tell you that. But if you do go over a bridge, you maybe not drive, or you close your eyes hopefully while you're not driving. And so you just do something to mitigate ever having to do that, and if you do, it's kind of a once-off event. And so most people can kind of navigate their world without their phobia impacting them. But of course, once it becomes impairing or impactful, then it really meets criteria for a problem, and then we got to do something about it. So the dentist, it makes so much sense. The dentist is typically a place where people have uncomfortable experiences, if not downright fright and fear and pain. And so based on associative learning, classical conditioning, when you associate pain with anything, you're going to develop a relationship there. And so because the dentist is not very comfortable and it smells weird, and frankly we don't go very often, it makes sense that a fear can really develop. And then it's hard to decondition that fear because we don't go very often. And so if you go to the dentist once or twice a year, kind of routinely, and you have that fear, you're pretty nervous. But of course, if you really fear the dentist, you avoid going as much as you can. And then as a paradox, when you have to go, you actually probably are required to have more extensive work done because you haven't gone for some time. So how do you get over that? So there's many things you can do, but think about building tolerance over time. And why is it important to get over that? And so if you're outright just avoiding, or your children are completely avoiding going to the dentist, you're going to have to just build comfort with them getting used to being there. And so what I mean by that is, if you think of building a hierarchy, so to speak, for getting in the door, and that could look like making trips to the dentist when you're not having a procedure or you don't even have an appointment. So we can associate the dentist with a less scary place by spending time there or in the waiting room when nothing bad is happening. And so if I go to the dentist today, or I take my child to the dentist and she's very afraid, but we're just hanging out in the waiting room and we bring a book, or maybe I bring one of her toys and we hang out for 15-20 minutes and we leave, and we start doing that regularly, she's going to build a different relationship with going to the dentist. Then, and dentists in my experience are awesome with this, and then they'll accommodate you sitting in the chair or hearing some of the noises or whatever it is, and you just build tolerance to these things over time. But it takes time, and getting over any fear is not convenient. Of course, taking your kid to the dentist and sitting in the waiting room regularly, and the more you do it the better, is very inconvenient. And so what we're always measuring is the inconvenience of overcoming this fear, or reconditioning our brains to these experiences. Is that worth it? And so, well, if your kid is outright refusing to go to the dentist, then I would probably say yes. If it's causing them significant psychological distress, I would probably say yes. If they get there but they're kicking and screaming, but they get their annual checkup. I don't know how much work you want to put into that, but know that is absolutely possible. And that's the same for any phobia. And so using the dentist is one example. So we can pair decent feelings with or neutral physiological experiences with being in places that are scary. So one thing I will say to avoid is don't try and talk it up like it's going to be okay, or use your nice squeaky voice to people like it's going to be okay, you're going to be okay, you're going to be okay, because that actually, one, builds anxiety. Kids know that you're anxious, and so they react to that anxiety. And it's also a little bit invalidating because it is uncomfortable. And so it's much better to be kind of calm and collected and matter of fact and just say, yeah, this is really scary, we're going to get over this by going and just kind of hanging out there. And then if you want to, reward effort. So if every time the kid goes and just hangs out and is willing to sit in the waiting room and play a game for 15 minutes or 1 minute or half a second or pull up outside, I mean, you've got to kind of be incremental here, depending on what they're willing to do. You can reward that effort with something. Well, and that reward might be just spending that one-on-one time with the parent who's hanging out there. And so, and then you can ask for the dentist to interact, and then again, just sitting in the waiting room, your child is going to be exposed to all the noises and the smells and the staff, and what happens is their physiology will go right back into this heightened state of fear because their body's used to that stimulus and that association. And as they're waiting in the waiting room and now they're not anticipating a procedure, their brain says, oh, we're not in danger, and it relaxes. And the more opportunities they have for doing that, the more distressing it is. And then we have to be very validating that their experience is uncomfortable, because whether you're getting a shot in the mouth or people looking, it hurts. And so what's helpful is to say, this is uncomfortable, but are you in danger? And helping kids distinguish the difference there is really important, because we can be so empathic for both experiences, but we want to be really empathic for like, this is really uncomfortable and it makes sense to me that you don't want to be here, but it's necessary and you're not in danger. And what I'm not doing is exposing you to an experience so you enjoy the dentist. I'm not making you think that you should enjoy being there and it's all okay. It sucks, it feels bad. But what I can do is help you learn that you're not in danger, and so your body doesn't have to respond as though it is. And the more effort you put into that, the better they'll get. The one thing I will say for parents is to be patient. Usually by the time people are asking for help or advice with these things, they've been problems for a while, and then parents all of a sudden, once they decide that they need to fix it, become very determined to fix it quickly, which is just unrealistic, and puts a lot of pressure on the kids. It's like, this has been learned for 5 years and then you want it over in 2 months or before the next appointment, because all of a sudden you know now work needs to be done, and so it's just not going to work that way. So have realistic goals. And you can apply this to lots of other things that kids or yourselves worry about that you can build incremental practice to. So if you like this video, please like it or subscribe it. Thank you so much. I hope it's helpful, answer some of the questions. If there's specific content you would like me to discuss, kind of generally, of course, I'm happy to do so. This does not replace going to therapy by any means, and this is kind of general opinions and advice on how to overcome anxiety generally. And so I also have an Instagram channel that you could check out. It's Preference Over Fear, and I put some cool content up on there. And then if you would like some free strategies for managing anxiety or parenting, you can shoot me an email, kevin@nwanxiety.com, and I'll give you a link that you can put your email in, and you can download some free stuff. So do one thing every day that scares you, and try and make more decisions today based on preference than fear. Thanks for listening. Appreciate it. Bye-bye.